A new way to treat COVID-19. It's called monoclonal, and Enloe Medical Center in Chico is seeing success with it. Action News Now anchor Scott Rates went to Enloe and shows us what it is and how it works.
Well, over 200 monoclonal infusions have been administered at this hospital behind me in Chico. The lead physician at Enloe tells me that she's pleasantly surprised by the results.
What we found was really dramatic.
Dr. Marcia Nelson is the chief medical officer at Enloe Hospital in Chico. She says that they have been using monoclonal antibodies since mid-December to treat mild to moderate COVID-19 infection.
We started doing it as soon as the evidence started coming out that it was an effective way to help people get better faster. We have been doing internal projections for what to expect in the hospital for COVID hospitalizations since last June.
Those projections show that with the Thanksgiving holiday, there was a 233% increase in cases in Butte County alone.
So we expected a similar increase in cases being hospitalized at Enloe in January. And what we found was that our cases went down.
Down by about 20%. Fewer people walking into these doors with COVID-19.
That wasn't an accident.
But why?
We believe very firmly with our data that it's because we were using the monoclonal antibodies.
So what exactly is a monoclonal antibody? It's a very scientific term. What's the process like? These are all good questions. Let me show you.
So this mandarin with cloves on it is really the COVID-19 virus. All these little spikes, those are the spike proteins that cover the virus and that attach the virus to our cells. This IV infusion, the monoclonal antibody that goes through a vein, it attacks these proteins so they can't attach to our cells. And that's why it works. The important thing is for people to know that it's available and that they need to get tested so that they can know they have it, so that they can ask for it. And if they meet the criteria, which are pretty easy to follow, then it's offered to them and they come in for about a 1-hour infusion, get observed for about an hour, and then they go home.
Now, I checked for you. I can tell you that if you think you might qualify for this particular treatment, you can go to your primary care physician. You start there, get a referral to come here to Enloe, and then you might be eligible to receive that treatment. Reporting in Chico, Scott Rates, Action News Now, coverage you can count on.
And as of right now, this particular treatment is only for people who have had COVID-19.